Good evening to everyone. So, Dr. Nirmal Fredrick sir is a stalwart of Chennai Jampuram branch for a long, long time. He has involved himself in medical, legal, and also insurance issues. So, he is the right man to talk about this topic, and also our own Dr. Jailal sir. So, who is going to enlighten us, and I think the meeting will go on very well. And I think this time it's around now 95 members are there. So last time it was nearing 200. So hope more members will join. Thank you for the effort taken by Dr. Ravishankar sir, as the legal committee chairman, and also other members. Thank you for the opportunity.
Thank you, Gauri sir, for your quick and smart comment. And in fact, we have two international faculty today. Dr. Nirmal Fredrick on the NABH quality as an ophthalmologist, and our Dr. Jailal, who's academic, administration, leadership, two smart international faculty for us today. We will enjoy. I am sure it's going to be a wonderful, enjoyable, and a learning lesson for us. And I don't need to talk or introduce two stalwarts. Both of them are here. May I hand over the proceedings and webinar to Dr. Nirmal Fredrick. Welcome, Nirmal.
Thank you so much for the invitation and kind words, Ravishankar sir, respected president, past president, future presidents, and the senior members and leaders in this podium. I'm glad I'm sharing the stage with CMA President Dr. Jailal. Thank you, Jailal sir, for joining us. So thank you for joining, and a big round of appreciation and thanks to the medical legal team who've been doing a wonderful job. Ravishankar sir is a veteran in this and a wonderful leader to lead this initiative. I see all the other faculty members here and colleagues and friends. So good evening and welcome to this session on communication. Can I share my screen?
Yes, please. Yes, visible. Full screen, please.
Yeah.
Thank you. Thank you. Good.
Hope I'm audible.
Yes.
And this is indeed a very powerful topic and the most pertinent topic for today's thing. And so once again, thank the IMA leadership for the invitation and all the members of the legal committee for bringing this program on mitigating litigation with communication. The terminology itself is rhyming. I hope I'll have your attention for the next 30 minutes. So the power of 2 minutes. Let me start with this. My patient whom I met 6 years back, a 58-year-old construction engineer, came with a severe eye pain and vision loss. The diagnosis was quite easy. He had an acute angle closure glaucoma with very high pressure. So the choice was just giving the consent to my nurse and proceeding with the treatment. But somehow I had a intuition that I need to talk to him, get some more history. And so I spent 2 minutes with him. So since he is an engineer, I use the engineering analogy that your pressure inside is raising because of the block drainage. And the pressure buildup has given you this raised eye pain, redness, and the nausea and vomiting. Unfortunately, he also had a lot of systemic problems, so which he thought he's having a appendix or acute abdominal problem. So I had a lot of need to explain him that the pressure is building because of the block drainage and it has to be reduced to reduce the pain. And as a collateral damage, the nerve can get damaged. And as a temporary measure, we need to do a laser. So being engineer, he understood that. Fortunately, I also draw this in a piece of paper nearby and gave it to his wife. So the treatment went on. he had being multiple comorbid patients. He developed a lot of complications on the way. So multiple referrals and multiple treatment. After almost 1 year, his pressure got controlled. He did lose some amount of peripheral vision, but he understood the process completely. And when acute attacks, recurrent attacks came, this thing was again, I think my plumbing system got blocked. I'm coming to you for tomorrow for a checkup. So the outcome was patient understood completely because the story stuck with him for the last 6 years. And in spite of multiple requirements, he has been a wonderful patient. He has referred 8 colleagues and introduced to his company. It's a huge construction company, and we get recurrent referral from the companies. So the power of 2 minutes is not only gets you patient loyalty, but also prevents lawsuit in such high-risk cases. Effective communication in the workplace, in our workplace, it's not just about speaking clearly. It's about ensuring your message is heard and, in our case, seen and understood. Communication, the talk we know. So I was hearing this non-stop chat in the last 10 minutes. Is simple. And we take communication granted because we do it so frequently. But it's actually a complex process when it comes to healthcare. So few industries have more at stake when it comes to communication strategy than healthcare, because it does not only have to be passive, but also active and dynamic. So what makes healthcare communication different? So this is the important 5 differentiations we need to understand if you want to understand the power of healthcare communication. The stakes are very high compared to general communication. It is life-saving, life-altering, and also our practice-altering and our sleep-altering communication. The knowledge gap between patient attenders and us is quite substantial. In spite of ChatGPT, in spite of internet, this knowledge gap is a wide gap. And the emotional status in which the communication happens, so a lot of fear, anxiety, vulnerability in the patient mind. And now of late, we also have this legal weight in our mind. Every word is potentially scrutinized, recorded, documented, and few seconds it might go live to the outside world. And of course, in India, there is a cultural complexity, multiple languages, ethnic backgrounds, beliefs, and family dynamics play into picture. So the challenges of healthcare communication is it varies because the communication is between multiple groups, doctors and nurses, doctors and patient, administrators and doctors, medical and non-medical, and medical non-medical staff and patients. It's a very complex scenario here. And very many times this really happens. The doctor will see you now. I can't promise that he will talk to you, but he will see you. So this is what happens in most of our rounds in the hospitals. So this lack of communication leads to misunderstanding, and they look for information from outside world. This misunderstanding turn into disagreements because he perceives that is in a different way. And this turns into conflict, conflict into arguments, argument into fights, and fight into wars, which can go on to our courtrooms. So the cycle repeats until effective communication is present one day. We'll go to the healthcare communication and quality. So India records 5.2 million, that's a whopping 52 lakh medical injuries a year. And of that, 65% of sentinel events, that is adverse event due to communication failure. If you see the top 2, most of it is related to training failure or orientation failure, and of course, communication tops. So 70% up to 70% medical errors occurs as a result of poor communication. And this is completely preventable. So this is where, ladies and gentlemen, this topic is very important for medical professionals. And there is a silent epidemic going on. So beyond diagnosis, what really happens? The silence in miscommunication, particularly in surgical procedure, the silence is deafening. We have 27% more safety events if the communication is not there between nursing people and patient. And poor doctor communication lead to 15% safety events. So the numbers don't lie. There is a 400% increase in medical litigation in the last decade. And if you see the root cause analysis, 70% stem from communication failure and not clinical negligence. So this is the point we need to note. So today's mission is transform healthcare communication into your most powerful legal shield while improving patient care and our business outcomes. So the next 20 minutes or so, I'll be covering what does the patient expect from us and what are the standards for communication. So if standards are defined, so we can identify certain areas for improvement and what exactly we are supposed to do during crisis in our practice as well as in hospital. There are certain new framework to improve our communications and also train our staff and how we can audit and train our staff. And we can certainly measure communication unlike other measurable indexes. And social media of late have played a major role in this miscommunication. So how to tackle this? And we are dealing with Gen Z, which have born with mobile phones and these communication devices. And the senior members like us, we cannot compete with them, but we need to collaborate with them to reduce the communication challenges and what benefits. So I'll just rush through a few of the important informations and try to give you all this in a nutshell. So what does the patient expect and what does we perceive? There are two voices and two expectations here. So the two voices are from the physicians and from the patients. We are always in a hurry. We want to obtain a history, ask close-ended questions to get fact, get into a differential diagnosis and start treating. But the patient and the attenders have a different voice. The voice of experience, the voice of suffering, the voice of anxiety, voice of depression, and they want to tell the story of the illness to us. They are concerned with the personal meaning of illness, what they perceive, and speaks in response to open-ended questions. Very often it is not related to our fact-finding mission, and it is a storytelling from their point of view. So their expectation is listen to my suffering first, inform me about my disease, and don't overdo or underdo, treat me optimally. And one thing what our patients keep on asking is about the assurance or guarantee. But we want to really stick to narrate our symptoms, narrate your symptoms. I'm a patriarchal doctor, so follow my advice and trust me. So from the patient perspective, these are the mysteries of the medical world. So what are you doing for me? Why are you doing this rather than that option? Will it hurt me or harm me? And how long I have to undergo this ordeal? When and how will you know what all this means? So what is the test for? What is the procedure for? So explain it to me in the language I understand. But our task are these two F's. Find it, fix it, because we are trained for it. So there is a conflict between these two voices, and here comes the power of conversation. A 2 minutes engagement can really change this journey beyond medicine to the heart of patient care. So this CCC is very important now, the importance of care, communication, and compassion in our clinical settings. So skills in clinical practice, very often it is overlooked in our medical curriculum, but it's indeed an art to talk medicine in the language of a non-medical man. Very often we keep repeating medical jargons, so patients try to understand, but very often they can't ask us back. So this is what separates successful doctors from unsuccessful one. So the கைராசியான டாக்டர்னா nothing but நல்லா பேசுற புரியுற மாதிரி பேசுற doctors. So this includes the ability to engage with patients at emotional level. So this is what the connection they expect. So patient communication, the expectation to be listened is there with all patients. So on average, doctors interrupted their patients 18 seconds into the interview. So this is a recent study held by the Tata Institute of Social Sciences. And given a chance, patient would like to narrate for minimum of 55 seconds. So this is the time gap between us and our patients. So this is what I've been telling our junior doctors to follow 1 minute rules or 60 seconds, no interruptions. So which means we can hear the patient becomes tired telling the story and then cooperates with us for the further proceedings and examination. So time is an important determination of patient satisfaction. So in a doctor-centered practice, 7.8 minutes is the optimal, and in a patient-centered practice, for an experienced doctor, it is 8.5 minutes. So it's hardly 1 minute difference. And if you can give that 1 minute extra, patients are comfortable and satisfied. The next important point in communication is not verbal, but non-verbal communications. The body language and tone are continuously monitored by the patient and their attenders. And nowadays, there is a third eye, that is the patient's or attender's cell phone. It is being recorded. So this study also gave information that 50 to 60% of all our patient interaction are recorded either with audio or video. So which means we need to be really careful about not only the verbal language, but also the non-verbal messages we are giving. So this primary way that communicate emotions very, very important in patient-doctor communications. So these three are very, very important. A smile and pleasant face. Unless patient is in severe distress, at that time we should not be smiling. And eye contact is very, very important. So not only in business as a customer, but also in healthcare. And how you look is really important and has a big impact during clinical interactions. So are there standards for effective communication? Of late, accreditation bodies is focusing more on this than pure medical standards. So this chapter is NABH chapter 4. Patient talks about patient rights and education, or PRE chapter. So this standard prescribes a system for effective communication with patients and their families have to be there. So how do we implement this? So you need to have a system in place to integrate communication requirement in the hospital design, which means we need to plan very well to integrate all this. So we'll be receiving a lot of emergency patients. So their communication need has to be addressed. And all these things have to be integrated. And a lot of visual and auditory signages have to be there. So this is an important aspect of patient satisfaction in accredited hospitals. The next one is the mechanism to capture patient feedback and to address complaints. So this has played a major role in addressing patient satisfaction and patient experience. So of late, many hospitals are capturing patient-reported experience measures, so or patient-reported outcome measures. So these are becoming core standards in accreditation and patient quality. So how do we do this? I'll just give you some more notes on these standards. So the common cause of litigation, if you analyze, it's not only 70% communication, but also the failure with reference to these things. So majority of this problem, medical legal problem, happens because of consent issues, communication, and the cost. If we can address these 3C, consent, communication, and cost, and also have an efficient complaint management system, most of these communication-related litigations can be reduced. So effective communication with the patient and families, there has to be all the components. So what are these components of effective communication for all categories of staff? So this 8 is very, very important for all healthcare professionals. So one is encouraging to continue, which means we should not interrupt. The second is appropriate eye contact. The questioning and summarizing has to be in front of the patients. open and relaxed body language, and when they are talking, a receptive nodding or shaking head, and when they are crying or emotional, a minute or second of silence really helps. And checking for understanding, so summarizing and asking them and encouraging to continue. So this 8 step are the components of effective communication with every patient interaction. But what really happens in our setup is there is frequent interruption, and there is a traditional hierarchy. You better listen to me rather than you talking. And the roles are unclear, so too many handovers, right? From reception staff to intermediate staff to some nursing staff, a lot of paramedical staff. So there is a lot, multiple hands, and the patients are really confused and lack of team or systems approach. So how to hand over a patient? So this ISBAT technique is an important one when you hand over a patient to another unit, to another doctor or another healthcare professional. So first one is identification of the staff, identification of the patient. Both are important. So the staff have to identify themselves with uniform, badge, or telling about their designation. And situation, what is the current problem? And then the background, the history, comorbidities, and what is the present assessment and previous assessment, vitals, and what is the recommendation, both investigation and medication to be given. So this actually reduces a lot of communication problem related to handover. And there are special situations where enhanced communication would be required. So these are the special situations. Whenever you start doing a surgery or breaking bad news or adverse events, handling an aggressive patient or family, and counseling for complicated interventions. So all this are BBN interventions. We need to be really trained and prepared for handling breaking bad news. So this special situation needs enhanced communication, and there has to be a training for our staff. So what is this? So there is a framework for breaking bad news. We call it a spikes framework. So the setting has to be private between the physician or the healthcare team. It has to be in a comfortable environment and assess the patient understanding. So basically the background of the patient and the family. And we can invite them, either the patient or the family members, ask how much they want to know and share the medical information in the language they understand and respond to emotional reaction. This is where we falter most of the time. And also plan next steps together with patient and the family. So the way you deliver bad news can determine whether patient sees you as an adversary or a friend in their healthcare journey. So in medicine, as in life, it's not what you know that matters most. It's how well you can share what you know with those who need it at this critical moment. So the next standard is identification of the training net. Most of our doctors and staff are not trained for communications. They can speak for hours together, but they cannot convey critical information or bad news in the way it has to be delivered. So this is where staff training is important. So can communication skills be taught? We've been talking from first year or first year of, so the moment we start moving, we start talking. So can it be taught? At what level does it need to be taught? Who can be a good communicator? So it is a series of learned skills. It can be taught at all levels, and anyone can be a good healthcare communicator. So this is a skill and not an inborn trait. So there is a framework for training our staff in this. We call it as HEAL framework. These acronyms are easy to remember and to follow. So H means halt and listen. So stop multitasking, focus only with the patient. Active listening signal. So look at the patient and nod. Listen for real concern behind words. And before we discuss reports, what concerns you most? What is the main complaint or history the patient wants to share? The second part is very, very important. That is the empathize. So I can just positive words. I can see this is frightening. We'll try to help you out and also understand the family dynamics. And A is advise clearly, no medical jargons and technical details for medical illiterate. So here comes the visual aids and videos and all this new age mechanism like reels to make it short and sweet. So, and then the last part is very, very important. We can ask them to tell back what they understood. And the last L is link and follow. So what happens next? And what is the next step? Give summary if the patient is being discharged and schedule follow-up or review. And in case of emergency, whom they need to contact. So these are the important information. Most of this are there in our discharge summary. But if we can talk to them with the discharge summary in place and also urgent information and urgent contact. So this really helps the patient to heal in a better way. So how to assess this? So this is the gap Kalamazoo communication skills assessment form, which we use to uh, measure communication. So these are 5A, and I will not go into the details. Anybody who's interested further, I'd be happy to share this system. But basically, this is assessment of communication skills in MBBS interns with objective structured video examination. So these are the important thing. So when we assess the candidate's communication, we ask the patient what did the doctor do the best. So whether he built a relationship, how he opened the discussion, how he gathered the information, and whether he asked the question about patient family perspective and how closure was done, and what measures we can improve from the patient or from the interpreter. So they pick 3 choices and we build. So there is a communication transformation for our plan for our staff. So it's a 30-day plan. So the first week is doing this safe communication audit and ask them to record 5 patient consultations. So what mistakes they make or what is good about their communication, and also get from those 5 patients about the satisfaction with the healthcare professionals and assess team communication skills. The second week, I already told you about the HEAL framework. So ensure that is implemented with the healthcare staff and train staff on the protocols and the SOPs, and also develop patient education materials, frequently asked questions from the patient point of view, and develop these education materials in the narrative and local language. The third week, we implement these new communication protocols and document where mistakes happen or deviation happen. Gather patient feedback. Patient feedback survey happens in all the phases and adjust based on the result. And fourth week, we reevaluate, measure patient satisfaction and the improvement, and where all the team can improve and plan ongoing improvement. This is like any other project that we implement in hospitals. So communication is also being a skill. The project can be measured and implemented. So this is the audit of communication excellence, structure of the communication. So our consultation structured consistently and adequate time allocated for communications. Are the counselors and interpreters available when needed, particularly when you are handling illiterate patients or patients from other areas. Accuracy check is medical information conveyed correctly. Many of our staff don't convey medical information correctly to the patients. So this have to be monitored. And risk benefit alternatives. So this is the most important aspect of any consent. See whether it is being explained, because most of the time they just explain the benefits, but conveniently forget the risk, and see whether all these are documented and accurate. This is where communication documentation is important in medical legal practice. The F is feedback loop. So this is the most important part. Ask the patient what they understood, and also if there are any questions, this is the last word from them. And also assess their emotional intelligence and cultural sensitivities are respected. So this has to be documented and monitored. And these are the important communication related challenges now in the modern era. So I'm not covering the entire details, but just 3 important areas. What happens in crisis and how can we recover this communication breakdown? And as I said, what happens with Gen Z patients? So when things don't go as planned, so there can be crisis, there can be critical moments, but again, so we can, with this framework, we can try to have a service recovery So communicate immediately and honestly, escalate it to the next official and apologize for the outcome. So this is not admission of guilt, but apologies for the dissatisfaction. Reassure that we will help the patient and explain what happened and why. So expressing empathy and regret about an outcome is not admission of guilt under medical law. Even if they document or record it, it's okay, but it actually helps in service recovery. And now in the digital age, there are modern challenges. So people come with recording as well as WhatsApp and social media guidelines. We need to give guidelines to our staff about usage of these social media. So very often people get into trouble posting hospital pictures or patient pictures, particularly when VIPs or celebrities are involved. So we need to train our staff about this. And online reviews and reputation, we have to accept that this is part and parcel of this telecommunication era. So proactive communication. If there is a negative review, reply is important. So this actually helps build digital trust through communication. And as I said, Gen Z healthcare, a lot of challenges. And these are the group that really cause trouble for the senior people. So they are born with the digital environment. They never knew life without internet, smartphones, or apps. They will ask for Wi-Fi in the hospital. And this is the most diverse generation in history. And they're very open about psychological wellness and demand value for. We also employ them, and most of our staff now belong to this era. And they've been shaped by this COVID-19 crisis and youngest entering workforce. So in 2030, 30% of them will be this Generation Z, and they have a lot of purchasing power. Definitely, they will show a lot of attitude. And they are the first generation born into fully digital world. And these are the people who create challenges in the modern day healthcare situations. So they prefer in person for initial consultation, but want review telephonically or video consultation. They expect transparent pricing and digital options. They don't want paper prescriptions. They want everything in their WhatsApp. And we have to accept that they rely mostly on social media for medical information, and they utter disregard for provider advice. So how do we also have staff group in this? So they are most difficult to work with, and most of them will leave the job within 1 or 2 years. So we need to train them specifically for that job. And we also need to monitor them and also give a certain exposure about the healthcare and how it will affect their work-life balance. So when we want to manage them, we need to have proper written protocol. So they ensure they follow the professional communications. We need to have regular feedback with them. We need to mentor them and also have proper technology policies, when to use smartphone, when to use and how to use social media, and also work with them to develop their career, give flexible scheduling option. They may not be liking to work on weekend, but we slog on weekends. So the message is, let's get communication right and make it safe. So how do we go good communication and disease outcomes? So 26%, so this is a study again in a diabetic group. So two groups of patient identified. One group had consultation with doctors with communication training, the other without special communication training. So the patient who went with the doctors who had communication training had 26% better control and lesser drug or morbidity complications. So it's a significant difference between the two groups. So effective communication lead to better health outcomes, better patient satisfaction, greater symptom improvement, and better management of chronic illness, particularly diabetes, hypertension, heart disease, and now cancer. And what is the so much effort being spent on the training? What is the return on investment for improving communication in our healthcare setting? Obviously, reduce litigation. So that means we are saving 15 to 50 lakhs and decrease defensive medicine. So if you are very good at communication, there's 20 to 30% reduction in unnecessary tests because patient gives the diagnosis, and fewer appointment cancellations. And of course, as business owners, 75% patients choose doctors based on communication and particularly based on Google review. And more referrals, satisfied patient refer 3x more often. And we can do premium pricing. And in spite of insurance, we do get patients because of our loyalty and better communication with the patient. And staff retention happens because of the better workplace environment. So listen to your patient. He is telling you the diagnosis. So communication is very important. Particularly the listening aspect is important to get the diagnosis from the patient's mouth. The single biggest problem in communication is the illusion that it has taken place. So we have to get away from this illusion and ensure this happens in real time in the real world in our healthcare settings so that communication can really give us good return on investment. So communication is our legacy. So we need to remember every patient interaction is an opportunity to prevent a CPA case, build trust and reputation, create a loyal patient ambassador, and your practice with good communication will enhance not only your reputation, but also the brand image of your hospital. So the best battle is the battle that is never fought. The best war is the war that is won without a battle. So this is where communication will help to mitigate the medical legal risk and litigation. Let us all avoid the fight. The best way to deal with medical legal problem is to prevent them. And this is where communication has to be loud and clear. So thank you for the opportunity and thank you for the kind attention. I look forward to Jalal sir comment as well as the inputs from the senior members.